Alright, you're responding to Weber State University, 40-year-old male with chest pain.
Alright, I got my BSI on. Is my scene safe?
Scene safe.
Alright, so I'm arriving. I find a 40-year-old male patient. Looks like he's having some difficulty breathing. So at this time I'm going to just call it ALS. He's obviously in distress. He's holding his chest. And I'm going to probably rule out C-spine. Are you hurting anything?
No, just my chest.
Just your chest, but no trauma?
No.
Okay. So my name's Brandon. I'm an EMT. Is it alright if I help you?
Please.
Okay. So at this time I'm going to start out with give you some oxygen. Okay. I'm going to give you 15 liters non-rebreather. And I'm going to go ahead and start and assess the airway. I'm going to go ahead and listen to the lungs. Okay, so my lung sounds are equal. They're clear. Obviously they're labored. I'm going to go ahead and check the skin, color, temperature, condition. What is the color condition of the skin?
He's pale and diaphoretic.
It's pale and diaphoretic. So I'm going to go ahead and check a pulse with that. Pulse is strong and regular. He's got cap refill, which is good. He's going to be a high priority transport patient. So at this time I'm going to do my focus assessment. And I'm going to find out what's going on with this chest pain. So I'm going to ask you some questions, okay? And then I'm going to go ahead and we'll see if we can get you some medications to help this problem, right? Okay. So, are you on any medications?
I am.
Are you? What are you on?
I am. I was given this by the doctor the other day.
Okay. And did you have any allergies to medications?
I don't.
Did you have any pertinent medical history I need to know about?
No.
Recent surgeries, anything like that?
No. Just this heart thing that started a couple of days ago.
Just heart pain. Okay. What were the events that led up to this? What were you doing?
I was just sitting and doing my work, and I just started feeling this little pain, and it just started getting worse and worse. And over the last half hour, it's just been really bad.
Okay. And what's the last time you ate?
This morning.
This morning.
A couple hours ago.
Okay. Regular meal?
Regular meal.
Okay. Now I'm going to go ahead and ask my LPQRC questions. So, you said you were sitting here at your computer. Nothing else brought it on. You were not running around.
No,
okay.
just sitting here.
Anything make it better or worse?
Not really. It's just constant.
Does your pain radiate anywhere?
No, it's just right here in the center of my chest.
How severe would you say it is on a scale of 1 to 10? What would you say that pain would be?
About an 8.
About an 8. And you said about 20 minutes ago this started?
About 20, yeah, the last 20 minutes, so it's gotten really bad.
Okay. I'm going to go ahead and take some vital signs on you. After I take some vital signs, I'll call the hospital and we'll see if we can give you some medications, okay?
Okay.
Is that oxygen helping you at all?
A little bit.
Okay, keep taking some slow deep breaths for me. Go and just keep your arm nice and still for me, okay? Okay, so I've got 130/80 on the pulse, or I mean on the blood pressure. I'm going to go ahead and leave that there because I'm going to take another set of vitals later, okay?
Okay.
I'm going to go ahead and check your pulse at this time. Okay, so I have a pulse of 98, respiratory of 24. Go ahead and look at my eyes really quick. I'm just going to check your pupils. Okay, pupils are pearl. They're equal, round, reactive to light. I'm going to just check your saturation really quick. While that's working, I'm going to get out my glucometer. Okay, 96 on the room air. Just getting a small poke, okay? Okay, glucometer says it's 100, so blood sugar's good. So this time I'm going to check my R's. What was your name again, sir?
Toph.
Toph. So I've got the right patient, medication, right medication because he's got chest pain. Expiration date is good. And I'll continue my R's after I call medical patrol. So medical patrol, this is EMT Woods. I'm on scene with a 40-year-old male patient. Patient's having some chest pain with a little bit of difficulty breathing. At this time his vitals are 130/80, 98 on room air, 24 on the respirations, and 98 on the pulse. Glucometer showed he was 100 on his blood sugar, and his pupils are furrowed. So at this time I want to get permission to administer 1 dose of nitro as well as 1 dose of aspirin, which is 4 baby aspirin.
Administer as protocol.
Okay. Are you allergic to aspirin, sir?
I'm not.
Okay. You taking any blood thinners or anything like that?
I'm not.
Okay. I'm going to have you take 4 baby aspirin. I want you to put those in your mouth and chew them up. Chew them up nice and good. Okay. This time I'm going to give you 1 nitro. This nitro goes underneath the tongue. Just place it there, let it dissolve. Don't chew or swallow it. Okay. And now I'm going to document the time, and I'm going to reassess the patient in just a minute after 2 minutes of giving him the nitro. How's that medication helping you?
It's getting a little better.
How's that oxygen doing for you?
Pretty good.
Okay. So at this time, I'm still going to say he's still going to be a rapid transport patient. We're just going to keep going to the hospital as we were. My primary assessment, I'm just going to reassess. I already checked the airway, it's still doing good. It's improved a little bit. He's still alert, he's still talking to me, so primary assessment is good, it's improving. This time I'm going to take my second set of vitals.
Okay, now your blood pressure is 120/70, your pulse is 90, and your respirations are 20.
Okay, so vitals have come down a little bit, so that's improved. And we'll just say that we're arrived at the hospital.